Anyway, we've got some wonderful people. So if you wouldn't mind starting here, saying your name and the role you play and the agency you represent, and then pass it on.
Hello. I hope this is working because I can't hear myself. But I'm Jessica Harris, a school psychologist at Franklin Pierce School District, which is kind of the southeast part of Tacoma.
Hi, my name's Tammy Suleman, and I work in this building, actually. I'm a CWS Child Welfare Services Supervisor upstairs for Division of Children and Family Services.
I'm Shirley Karstens, and I am a school nurse course supervisor at Puget Sound ESD.
Hi, my name is Kelly Huckstra, and I manage a project here in Pierce County with Puget Sound Educational Service District, working with 14 school districts. It's called Safe Schools, Healthy Students, and we serve 92,000 students with that project.
And my name is Jody Hawthorne. I'm a social worker with the Foster Care Assessment Program, and actually I'm stationed out of Mary Bridge. There's two FCAP workers, is what we call it, in this region, myself and Carol Prigge, who's out of Children's Home Society.
Oh my gosh, these are some deep questions. What are some genetic markers of mental? First, before I don't want to act like Phil Donahue, because I definitely want you guys to have an open dialogue with our panelists. So are there any questions that are burning out there that, based on their roles or what they're involved with, that you would like to ask? By all means, ask away.
Kelly, the Safe Schools, Healthy Kids, can you just maybe summarize what that program is?
So the question is to elaborate on the Safe Schools program that Kelly works on.
Actually, it's a 3-year grant, and we're in our 4th year no-cost extension. However, I think we've been able to put some good systems in place. It's a federal grant funded through the Departments of Education, Juvenile Justice, and SAMHSA, Health and Human Services. And it was a $6 million grant to serve 14 school districts here in Pierce County, providing mental health services to students in schools, as well as early child care outreach, and working with a program we called Safe and Civil Schools with 39 school buildings, and parent involvement in all the middle school, junior highs, which equals 36 of those schools, as well as training for school staff from different districts on school threat assessment and management. So it's pretty large and pretty comprehensive and very exciting, actually. But I just want to add that even though like the direct mental health services are going away, the system's in place. And there are a lot of things that are in place now, even though the grant is going away.
Great. Question?
What happens in these programs? What are they?
What happens in these programs?
What are the services they provide?
Well, with what services were provided or are being provided?
Are being
Okay, well, with all the school districts, one of the services that we provided was training for the school threat assessment and management teams. So every school district in Pierce County has had training with that. That's a service. As well as parent involvement coordinators is another service that we're providing outreach to parents to create a family-friendly environment at a middle school, junior high, which is pretty big. And mental health services, we were able to provide 10 full-time equivalent positions of mental health therapists that worked in every school district. So the system we set up for that that's in place is the enhanced relationships and cross-trainings that went on between the mental health professional and the school district professionals. And early child care outreach is still going on until the end of September, reaching out to private child care centers, training them in a violence prevention program called Second Step, and training parents in the Second Step also, which is violence prevention. And also working with child care centers to ensure that they get to stay in business. Because what we learned right away was that a lot of child care centers don't have those business skills and struggle just to stay in business. So we wanted to stabilize those systems before we provided training. And also a lot of training has been going on around social emotional learning environments for young children, along with Second Step. And then we have 39 school buildings. It's been quite a project. 39 school buildings that have teams in place that operate on a system called Safe and Civil Schools, where it's a whole building-wide school climate project that includes classroom management and creating clear expectations for students. It's pretty comprehensive. Does that answer your question?
Yes, I'm also wondering, is that something that's in each county in the state, or is it just
Pierce. It was very competitive. It's a federal grant, and there have been 155 of these grants awarded since 1999, and we were just lucky enough in Pierce County to receive one.
And that's all you do?
No, that's not all I do.
Oh, I was joking. I thought that I was
Really
that's
isn't.
enough.
Welcome to school districts. No. Actually, we're in our fourth year no cost, so we're really working on sustainability and sustaining those systems I was talking about. And then I also manage a Safe Schools, Healthy Students Coalition made up of law enforcement, mental health, and school district folks.
Wow.
And then we also have a focus, sounds ridiculous, but we also have a focus on working with school districts and individual school buildings in Pierce and King County. Our agency serves all of the school districts, 35 in Pierce and King County, which represents 40% of the student population in the state of Washington. So one of the things we are doing is working with our schools now around how to increase partnerships, school-family partnerships, and making our school buildings more family-ready and family-friendly. And so I'm really involved with that project.
Wow. Well. Any other questions before I begin? Oh, there we've got one.
The question was, what do the mental health services look like that have been going on in schools, correct? Okay, well, we contracted with the 3 large mental health agencies here in Pierce County that are part of the Regional Support Network. So that was Good Samaritan, Mental Health, Behavioral Health Care, Greater Lakes Mental Health, and Comprehensive Mental Health. And they provided professional mental health therapists that work directly in school districts. They were placed in buildings. And the system that I think that we created that has been so successful is that partnership between school building counselors, mental health coordinator. We paid a mental health coordinator position in every district, or just a portion of their salary we call a stipend. And they created how the system would work in every district. So it's owned, which is a nice process, by the districts themselves, as well as the mental health agencies. And so students were referred through the mental health coordinator, through a team in buildings. What all school buildings have usually is a care team, core team, or what they call an MDT team, which is multidisciplinary team. And then they made the referrals and worked directly with the therapist, and the therapist worked in the buildings to see the students and many times worked with their families also.
Is that elementary and up?
Yes. And it really depended on how much FTE was available for each district. Our largest district participating in this grant was Puyallup, so they had like 2 full-time equivalent therapists. But then when you go to Carbonado, which has 180 students, they had 5 hours a week of service. So it really depended on how many hours they had for service in their district and the kind of program they designed. Many times it was just junior high was the primary focus for services. And sometimes it was a whole district like in Carbonado.
So Jessica, you're a school psychologist. You can probably talk more particularly about what the intake process is like and going through that for mental health services in schools.
You know, as I was listening to you talk, I was thinking about how this must be a little confusing, you know, how to access these services. And I was thinking about my role as a school psychologist and also our school counselor roles. I work primarily at Franklin Pierce High School, which is a high school with about 1,400 students. And one of the things I guess I would encourage you to remember is that a lot of these, even in the 3 years that I've been in Franklin Pierce School District, I've seen a number of grants come through for special funding for special programs, and they, you know, services will change. And I really encourage you to contact your school counselor, your school psychologist, to find out if you do have a child who's having difficulties, to find out what services are available. You mentioned that services look different in each school district, and I think that we're able to kind of help you navigate through some of those systems and talk about what is available. If we don't have resources, talk about some of the other services that you might want to access. My primary role, because I'm in a larger school, is evaluation of students for special education services. And I think that special education, like we knew it 30 years ago, has changed quite a bit, and that we're seeing more students and really identifying that students with social emotional needs may be related to a disability, and they may need special education services. And so it's the variety of students that we have. There's a large variety in the types of students that we serve. How those students are identified is not always as easy, but I encourage you to ask. The law requires that we look at how that student's mental health issues or learning difficulties are impacting them directly in the academic setting. And so a student may be having, you talked about depression. A student may be struggling with depression, but if that isn't directly impacting them in school, so if they're not making if they are making academic growth, be it slow, they may not qualify for services. But it's really the job of the identified parent or guardian and the school team to do that complete assessment and make that decision. So it never hurts to ask. I have a few handouts here about some of the primary services that school psychologists provide, and I also have handouts on what we call Section 504. Are any of you familiar with Section 504? Yes. Okay. I think that Section 504 essentially is part of the Rehabilitation Act of 1973, which says that in public settings we cannot discriminate against those with disabilities. And again, remember, we think of disabilities a little differently than, the services that we are providing and the way we identify people with disabilities has a larger range. And so the schools are responsible as a public place for providing services for students with disabilities, even if they don't qualify for special education. And essentially that would be something as basic as Section 504 is why public places have ramps for wheelchairs. It may be we have a number of students that have identified as ADHD, do not need special education classes, but maybe they need a quiet place to do their work. Maybe they need a written format of the teacher's lecture notes. So they would be provided as an accommodation under 504. They have a right to those accommodations to successfully access their classes. So those are all things that there's typically, every building has someone who's identified as their 504 coordinator. And again, ask your school counselor, your school psychologist. They're aware of who that person is.
So I've got a question that I'm going to read here, and it's kind of along the veins of special education, since we're on that road already. And this says, RE Special Ed for Children. I've heard that if they get a certificate of completion versus a diploma, the child won't be able to do certain things, like go to the armed services or go to a four-year college. Is that true?
This has actually just come out in this year that we've had OSPI, which is our state education agency, has identified two different types of ways that students can graduate from high school. Both ways require that they complete the dreaded WASL. that they complete the WASL, and which is everyone familiar with the WASL? I don't know if you're all state. The WASL is a statewide Washington Assessment of Student Learning. So it's a statewide test that all students are given at certain grades based on the area. So at our high school in 10th grade, they have to pass these 3 portions in the WASL, and now, as of the class of 2008, they will have to pass the WASL to graduate. Well, for a student with a learning disability, that is probably not possible for them if they have a learning disability in the area of English. Taking a written WASL, the English portion of the WASL, is not always possible. So those students they've done a few different things to provide different types of tests that those students can do. And again, the things like accommodations, somebody reading it to them, there's a variety of different things that they can do. And there's tons of acronyms that go with all of that. But But what they've said is that students who do have these accommodations or take a different form of the WASL are not going to receive the same diploma as a student who has taken and passed the standard WASL. There is some concern that that's a form of discrimination, that clearly identifies them. I think one's the Certificate of Academic Achievement, and the other one is the Certificate of Individual Achievement, I think CAA and CIA or something like that. And so we don't know exactly how that's going to impact students. Obviously, a 4-year college cannot also discriminate against a student and not accept them into that school, but there is some concern that it will be clear that that student has some form of a learning disability or some other disability that's not made it able for them to pass the WASL. Does that answer whomever's question that was? So I wouldn't, they're still working, a large portion of general education students don't pass the WASL, and they're still doing a number of things to help students to pass the WASL. So we're encouraging parents not to stress out too much about being able to pass the WASL, that's the area. Uh-huh.
I don't understand this WASL. These kids actually go into shock when they have to take the WASL. And I would think that this money, instead of doing this testing, these funds and the cost of doing this WASL could be applied to school districts where we're over-enrolled with children. Build better facilities and stuff like that. Get class size down so that the teachers can teach the children.
Well, that would be great. We'd actually like both, I think. We'd like the extra funding, and also I think that and maybe some of our other panel members want to contribute on this one. Okay. I turn bright red. I actually do, as someone in the school district, I think the philosophy behind the WASL is good. It says that we should all school districts should be accountable for providing all students with a certain level of education, right? So regardless of your access, whether you're in a inner city area where there's larger class sizes, that all students have a right to the same level of education and to making those same academic gains. And so therefore all students in the state of Washington are administered the same test to see whether they're making those same academic gains. There is some question about whether the WASL is the best way to measure that gain. Yeah. Yes?
What I hear you saying is then the WASL is primarily used as a tool to assess the teacher's capabilities of teaching the students, and since the students fail, then therefore the teachers fail.
Well, there is some question about that, and there is if students don't meet these certain levels of proficiency. Your question was, sorry, I didn't repeat it, that essentially is the WASL assessing a teacher's ability to teach.
And then if the student doesn't get their diploma, it's due to the fact that the teacher didn't teach correctly.
And I think that that's a very valid point. I think that that's one of the reasons, one of the things that they're looking at, and many schools are schools of improvement. Is that correct? And that they haven't met proficiencies. They haven't met those standards, and so there are additional supports that are being put in place to improve that. So, yes?
I think it goes to what you just said, but with the WASL, that's assuming that all the kids have the same quality of education.
Correct. Correct. And that's the goal, is to say that all kids deserve to have the same quality of education.
There's a gentleman over there.
And then it becomes...
when you're putting the cart before the horse.
Right. I am not putting the cart before the horse.
I want you to know, she did not come up with these policies herself.
No, I understand. And this is a common frustration.
Yeah.
Common frustration.
Especially get the schools up to grade, up to snuff, then do the testing.
Right, right. And there are, I think the WASL is a work in progress, I would hope.
But the kids are going to suffer from it.
Right, right.
So it's a work in progress.
I just wanted to add, the WASL is what Washington State came up with as a result of federal mandates from No Child Left Behind that states will develop and will have an assessment of learning to ensure that the standard of education determined by the state. It gets very detailed, and I certainly am not the expert the psychologist is, but a lot of this is we were told from up on high that we will do this. So it isn't always a matter of taking those dollars and putting them in the classroom instead of.
I want to ask you a question. Is that true that they have a program for the summer for kids to take the WASL?
It is true that there is a no-cost program for students that have failed portions of the WASL to receive essentially, in our district, our primary summer school is for students who haven't passed portions of the WASL. Yes.
So how would you access that service for?
Through your school counselor, at least at the high school level. Yes, you would, and the school principal, she said, to access those summer school programs.
Then there was.
The question is, are there accommodations for ESL students on the WASL? Yes, there are, and I'm not familiar with what those accommodations are. I know that there's the number of years that the student's been in the school system will also dictate that, whether they're exempt from the WASL.
Are you involved in the nursing programs? Is that what I heard?
Yes.
I want to ask you, I'm just curious, what kinds of things are you finding in the nursing program that are happening to the children in schools? What kinds of situations or profiles or things are happening these days with the students that you and the nursing staff see? I mean, physically, emotionally, whatever you want to address without violating it.
He's asking what, basically, as I understand it, what kind of, or what changes are school nurses seeing in the schools in comparison to previous years. And I would venture to guess that when you all went to school, if you had a nurse in the building, they primarily put Band-Aids on, correct? Maybe gave shots. That's not what's happening today. Just as you see children in your foster care programs and out in society with all kinds of abilities and disabilities. In schools, we have kids that 10 years ago would have been in a hospital or at home and not in schools. School nurses have children with life-threatening health conditions. And the role of the nurse is not to put Band-Aids on those kids, but the nurses in most districts, as a general rule, are in a school between 1 to 2 days a week. And they rely on health techs, para assistants, office personnel, whatever the title, to provide that care. And so what's being done is what the nurse feels needs to be delegated is done by unlicensed but trained individuals. Some children require licensed care. A lot of that is licensed practical nurses giving that care, and oftentimes that is strictly on a one-to-one basis in a classroom. There are children on ventilators in classes. There are children with very serious heart conditions in the classes. Children with severe allergies, severe asthma. Diabetes is climbing. We see it in the school. When I first started school nursing back in the year 01, I had one child. No, that's 1901. I had one child in the entire school system that had diabetes, and fortunately he was so broadly covered with medication that he rarely had a problem. And now what they try to do is to keep the child normalized as much as possible, which means they get lower doses of insulin and they can have reactions much easier, and they need a lot more monitoring. So teachers oftentimes are just shuddering because, they're all saying, hey, I got into this to be a teacher, not to be a nurse, and that's kind of what's happening with the evolution. So,
just a follow-up, just real quickly, are there more reports of abuse and neglect?
And I mean, the whole mental health issues, all of that has changed as well. And I know I talked to my program oversees providing nurses in the small district like Carbonado, Ording, Derringer, that have fewer than 2,000 students. So, and I just talked to one of the nurses in my program the other day, and we were talking about a child that in first grade who had come to her with threats of suicide. And people just are shocked when they hear that. But I think that everybody in the school system is seeing kids with many more mental health conditions, and certainly child abuse is out there, and I think as society demands increase on families, that there are more instances of child abuse, and with issues with meth. I mean, I'm preparing to go up next week to Skycomish in King County, and that's one issue I plan to talk with them about, is the high incidence of meth.
I just want to add one more thing. Through the Safe Schools Healthy Students Initiative, they saw almost 1,500 students in these 14 districts. And what was interesting for me is, in speaking with the therapists, qualitatively they said most of the kids that they were seeing either are living with family violence or have suicide ideation. That's a lot of kids. That's a lot of kids. Not all of them, but a good portion were.
So I'm wondering now if maybe we can switch gears and talk a little bit about the children's and foster care particular services, because the other, we've talked quite a bit about schools, but then Children's Administration, or Tammy, who's been so gracious to come down here and talk about, even though every foster child is eligible for Medicaid and they usually get their services through that, there are also some things locally that you can probably take advantage of for kids in care. So.
Well, of course, we always try to use Medicaid first to exhaust that resource, and sometimes they're not able to. They don't meet the criteria, so they're not able to to have those services. So we have to look at other ways to get those needs met. Oftentimes, we refer to Jody's program, the FCAP program.
That's the Foster Care Assessment Program.
And because they do kind of a holistic approach, and they have community resources that they can give us, ideas, places to send people. We also have therapists that we contract with, and so we have certain therapists who work really well with children, and we can do things such as individual therapy, where they can come to the home or come to the family, depending on. Some of our children are with family members, some are with in foster care, relative care, as you guys know. So we have therapists who actually can go to the home and do that, do services. We refer to public health nurses who also do some of the early infant mental health. So we can refer for that. Trying to think of the other programs. I don't know if you want to step in. There's, excuse me, children. No, you can talk about that. You can talk about that one. So we have people who provide play therapy, although there's not a lot of people who are contracted with us to do that, but we do have a few. We are getting a little bit more, so that's good. So if anybody of you out there have resources who want to get contracted, please send them our way, because that's definitely a need that we have. So.
When is it appropriate for a child for play therapy? What age is appropriate?
Well, oh, thank you. She's a table monitor up here. She asked what age what age you can refer for play therapy. I think that different people have different perceptions on that. I think it depends a lot on the child, too, where they're at emotionally, socially, and whatnot. We've had some as young as 3, but not, sometimes that's difficult. Sometimes the younger ones get referred to that more than the older ones because the RSN won't service kids that young. The community mental health, the people that, like Greater Lakes, Good Sam, we have a hard time getting kids that young into that system. So they can, we just have a very few providers, so I don't, I'm not sure that the audience out here, because we weren't able to meet all of you all, but I know that a lot of you are CASAs because I recognize you. So we don't have a lot of providers who do play therapy, so I don't want everyone to go out and say play therapy, because we really don't have a lot of those. But 3 or 4, 5, 3 is really young, really young. So, and not a lot of people will take them that young. So.
And would an FCAP assessment identify the kind of treatment that maybe somebody needs after they go through an assessment?
The foster care assessment program, which is kind of a misnomer because it should, I think, really be foster child assessment program. So what I do is I assess the child. not you guys, I promise.
You're all doing a great job.
Thumbs up. So the 2 primary things that we're looking at is, number 1, what are the service needs for that particular child? And then the second thing is, what's the permanency plan? And more importantly, do they have the supports they need in order to make the permanency plan successful? So when I get a case, I'll get a paper referral from the DCFS worker. And the first thing that I do is I contact the worker and I do an interview with the worker just to try to get a sense of what do they know about the child, what do they want FCAP to accomplish. And then I get to go do a file review. And that can be anywhere from 3 to 12 volumes of information that I go through. And so when I'm scanning through all that information, what I'm really looking at is number of placements this child's been in, what's the average amount of time in each placement, is there any type of pattern around that, if there's been any type of assessments done in the school district already. Does the child have an individual education plan? That type of information is very helpful. When kids first go into foster care, they used to call it Kids Screen and then Pre-Passport Screen, and the name has changed.
Chet. And on the back of your handouts, if you turn it over, you will find all of the assessment tools that they use for Chet.
And so sometimes a lot of times that's really helpful because that's going to give me scores of what that child's functioning was when they first came into the system. So if I get the request to do a review, let's say a year after he's been in foster care, he or she, then I can look, what were they doing a year ago as compared to now? And that can give me some real nice baseline data, so I always look for that. If the primary plan is for reunification, then I'm scouring the volumes looking for assessments that have been done on the parents or the family member who's supposed to get the child in the future. So I'm going to look for all that information too. So you really do a real thorough look at what's in the files. And then if there's things that are missing in the file, then you get to go about kind of being a detective and trying to find that information. So a lot of times if I know that the child had a child find screen through the school district a year ago, but there's nothing in the file, then I'm contacting Dave Lewis through Tacoma Schools or whomever to get that information, to get those scores. So once I get all this background information and review the file, then I start contacting all the key people in the child's life. So obviously I'm contacting the foster parents because that's one of the primary sources of information. Teachers, mental health providers, private agency case managers if the child's in a private agency home. Talking to the school counselors, the DCFS workers. Sometimes I might even, if the child's new in a foster home but was in a previous home for 3 years, I'll contact the previous foster parent to get a sense of what are that child's strengths, weaknesses, challenges, difficulties, so that I can get a better sense of kind of their functioning. once I have all this information, and then I also obviously meet the child, and that really depends upon the child's age what that looks like. If it's a little guy or girl, I'll spend some time just observing them in play, try to get a sense of kind of how they interact. If it's an older child, then I will spend some time chatting with them and getting a sense of kind of what their thoughts are. We're always supposed to ask where the child wants to live, which is always just such a loaded question for the older kids. And it's always interesting the answers you get, because you usually don't get, I want to live with mom, or you get, I want to live at Disneyland, or I want to live in Hawaii, or it's like, okay, me too. So even though that's on my structured format for interview, I always just kind of have to chuckle when I ask that question, because you never know what you're going to get back. So I take all this information, which can be anywhere from 6 to 10 pages of information, and I develop what's called a preliminary report. And then my preliminary report is distributed to my review team, and that consists of a psychologist, a psychiatrist, and a pediatrician. And then the DCFS worker gets a copy, and then the private agency case manager would also have access to that information. And then I sit down with the review team, and they have my preliminary report, and they kind of give me ideas, make suggestions, recommendations, feedback. Just give me a lot of, sometimes it's really helpful information, sometimes it's less than helpful information. But take all that, and then I develop an impressions and recommendations section to my report. So I'll come up with some pretty clear sense of what I think the strengths and challenges are with that particular child. And again, I'm really looking at what are the services that this child needs based on the information, and how is that going to fit with a permanency plan. And then make a recommendation section. That final report goes to the DCFS worker. And then, fun's not over yet, I keep the case open for 6 months, and during that 6 months' time, I'm available to help get those recommendations implemented. So if through my assessment I think, this child could really use some additional, needs a speech and hearing evaluation, then I can, being at Marybridge, that's one of the reasons why they have the position based out of Marybridge, then I can help the family access that particular assessment, and then go from there. The question was, how much time do I spend with the child as compared to compiling information and talking to the key people? And it really is not a substantial amount of time. I really am taking more what other people's impressions are, rather than my direct contact with the child. And that's kind of, the system has been developed by Harborview. It's kind of their program, and that's kind of how it's been handed to me. I'm not a therapist in this job, so I don't go in and build a deep relationship with the child and come up with goals for, clinical outcomes. That's just not my role. It really is an assessment.
You know the people that you work with pretty well so that you can understand the implications of what they're saying?
I know them very well. Especially the psychologist. I've been at Marybridge for 12 years, and I've worked with him for 12 years. So I know Dr. Bilkey very well. And also Yolanda Duraldi, the pediatrician, I've worked with her for 12 years. So I have a pretty good sense of, what their recommendations are, and I think they have a pretty good sense of me as well. Okay, the question was, how do I get my referrals? And essentially they come through the DCFS worker. And it's interesting because a lot of times when I'm there doing file reviews, it's a huge office, and you can hear people talking. And I think that, although Tammy, you could probably speak to this better than I can, I think that sometimes other people might suggest an FCAP review, or...
Some social workers know about the program and use the service more than others, and I'm sure that you can attest to that. A lot of times it'll happen during a staffing. Maybe a child is having a lot of different problems in a lot of different domains, and we're kind of struggling on how we can help this child have some success. And so a lot of times the referral recommendation will come out of a staffing, like a permanency planning staffing. I don't know if you guys have gone to those. They happen up with us. They're supposed to happen about every 6 months to a year. They're supposed to happen, permanency planning staffings. And a lot of times that's where the recommendations would come from. We talk about the child, and there's a lot of questions. And so a lot of times the FCAP is a good place to start to try to get some of those questions answered. The question was, as a foster parent, should she contact her social worker? As a foster parent, you're always welcome to come to the permanency planning staffings, or and if you want someone to be referred prior to that, you can ask your social worker to refer the child for an FCAP and give reasons why, why you would like that to happen. And so then It's a pretty easy process. We just make it's hard for her, but pretty easy for us.
I have really strict timelines. So when I get a referral, I have about 3.5 weeks to do a case before my team review. And so all that background information needs to be in my preliminary report. I get 3 cases in 1 month. So that's kind of the timeline. And that's the reason why if you ever get contacted by me, I'm pretty pushy. I'm like, oh, you know what, the packet's to you. Want to meet with you next week? Because I have kind of a short timeline. I know that the referrals that I'm working on right now were referred to the program or given to the FCAP coordinator in March. So it's a couple months out before I get it, but once I get it, I really hit the ground running.
We have a program called Make Your Day that is very popular with our middle school administrators, and it's a STEP program, and it's all about a philosophy that you're interfering, a student is interfering with the learning, their learning or the learning of others. And I don't know exactly how the steps work. I do some evaluations in the middle school, but I think it works something like step 1, you're removed from that environment and into another setting. Step 2, and they progress up to what is a step 5, I believe, is the highest, in which a student would be suspended from school. And so the question is, do we see any mental health that sort of, I see you shaking your head no. Did you have
the last step that you mentioned was the child is put in the office, the parents called, and then the child cannot go back to school or attend school until the parent physically comes up to the school and has a conference over the behavior of their child. But the steps leading up to that is, one is staring at a wall in front of all of their peers. I've witnessed this myself the other day. And then the second step is you got to stand against the wall and read the sign over and over again, and if you move your hands or move your head, then you go to the next step level. I mean, it's very strict, and I find it humiliating to the student. And this is middle school, but then they go into high school, and when you do this in front of their peers, it's a humiliation thing.
That's brainwash.
That's garbage, and I don't, I have children over at Ford Middle School. I've dealt with this over and over again.
Right, and I would encourage you, it sounds like you have some strong feelings about this program. I think that the level that the program itself is interpreted varies from school to school. And I haven't watched, I know there's a Make Your Day video that goes with this and that they're trained. I don't know the extent, like I said, I'm not familiar with that program. At the high school, I haven't seen a correlation between students coming from Ford that come to the high school. Our high school has a fairly traditional disciplinary program, so there's tardies, and then X number of tardies accumulates, and then you may have an after-school detention, this traditional program. We haven't taken, I believe that Washington High School or other high school is using the Safe and Civil Schools program. But I haven't seen something directly relating to that. But I have heard other parents voice their concerns and be happy that now their student is no longer in the middle school and is in a high school where there's a different disciplinary procedures.
Well, I was just wondering how it has an effect on their mental abilities, going from a middle school into a high school, or even just at the middle school from 6th grade through 8th grade. That has got to wear on with children in foster care, especially having to go through those STEP programs, on their mental and their anxiety. Right. It has to have a toll on them.
Yeah, I don't know. I haven't ever thought about any correlation between that program and then the struggles that we see in students. We don't have a higher rate of referrals for mental health concerns directly related to students that have come out of Ford. We have a higher rate of referrals for mental health concerns at the high school level because I think that that's when a lot of mental health issues start presenting themselves. And so that would be.
I'm not an expert in it, but I will tell you that they were trained for 2 years to do this. She wants to know how the Safe and Civil Schools is structured as a program. They look at everything from hallway behaviors, locker room behaviors, locker behaviors, to how we clear expectations about when we have a concert in the evening, how students should behave. They deal with every part of the building and how, everything that creates a civil environment, from bullying prevention to teachers having clear guidelines in every classroom that are the same in every classroom, because for a long time, and I know this is still an issue, some teachers may send a child out of the classroom because they're chewing gum, to the office, where in another classroom it's okay to chew gum. I mean, so it's about really getting these guidelines to be clear for every classroom being the same, every adult being present, during passing times, to create that safe environment. And it includes yearly surveys of students, staff, and parents about safety concerns in the school, and then the team looks at those areas and makes changes. I don't know if that really answers your question. It's just very, very comprehensive. And the piece I really like, too, that I think is important is that the classroom management piece is very well put together. And a lot of staff are getting trained in a program called CHAMPS. That's the classroom management piece.
There, very quickly, there was a number of questions here asking about autism spectrum disorder or Asperger's or genetic conditions. And you have briefly, Jody, mentioned the Children's Special Health Care Needs Program. And I wanted to give you a chance to talk a little bit about that, because it looks like there were a number of thoughts that were here in these questions before we moved on really quickly. So I just wanted to give you a chance to talk briefly about Kishkin.
Okay, Children's Special Health Care Needs. That is a program that I believe is actually run out of the health department, although I'm not sure.
In the Office of Maternal and Child Health, where I work.
Yeah. They just happen to be stationed at Marybridge. That's the reason why I know about them. But essentially, how I've accessed the service before on behalf of families is if you have a child who has, and I think because of funding, it has to meet more and more criteria in order to qualify. But essentially, it's a nurse case manager who will work with that family. So if you have a child who might have some developmental delays and some medical issues, and a family that's, having a hard time keeping it together, the nurse case manager will go out and case manage, make sure the child's getting the services that they need, get the family hooked up with Division of Developmental Disabilities, SSI, that type of thing. And so that's how I've used them in the past. And the nurses are really great. They're really committed and really knowledgeable. So.
And Asperger's falls under that autism category. So.
Are the children supervised when they are in the health room, when they're ill and they're resting or whatever? It's basically what she's asking. And some districts have a health clerk in that room that helps the children that are in there. Other districts do not. It falls on the office personnel. I would like to say that every district has a health room. Not all do, and there's no requirement by law that they do so. The secretaries in the school offices have a huge multitude of responsibilities, and I think, to be fair to them, they do the best that they can, given the telephone answering and the students coming in and the principal wanting things done and the announcements to be made, and the parents who call and want the last minute, at the last minute of the day, please tell Johnny not to take the bus, but I'll pick him up, and do all of those. So they do it to the very best of their ability given the resources.
The reason why I'm asking that, because my daughter has a health issue and she passed out at school, and she had a cell phone and she was laying down in the back room asleep. A guy came up and took her cell phone out of her hand while she was in the back room. They didn't have no accountable who walked back there and how many people, because there was nobody's supervision.
And I know that that is a possibility. Some schools, the health room may not even be near the office. Schools try resources are very limited, and certainly when issues like this occur, you need to talk with the nurse who may or may not be there, but you need to let them know. And it is. Right. And then you need to talk with the principal of that building. Ultimately, what occurs in that building, he needs to be aware of. A lot of schools are beginning to put cameras in the health office so that they can monitor that when the nurse is not there. That's not terribly expensive. I know several districts that have done that.
We also have providers who do social emotional developmental screens for children, is another way, an avenue to get services out. We have bonding and attachment assessments that we do sometimes for parents and children who maybe aren't connecting all that well, and maybe they'll have some resources.
So, would reactive attachment disorder be something that you would...
They could do that,
Okay.
and maybe they would have recommendations as to a therapist who could maybe work in that area. If you have kids who are going to be adopted or maybe with you on a long-term basis and you're needing some help with some transitional skills, how like grief and loss for them, we do things like that as well. We have people who provide that service. And there's a lot more, but I wanted to make sure I got those out there because those are good services. So.
We talked briefly about RSNs, but RSNs are the regional support networks, but we also refer to them as community mental health. Mm-hmm. So any of the services that they're talking about that are Medicaid, kids are eligible for Medicaid, that's RSN funding. So we haven't called it RSN per se, we've called it community mental health. So sorry about the acronym game, because we in government love to talk that way.
Well, we're asking, do we know about it and how to access help for a child who needs? So basically what you all are saying is there's different avenues, you offer different things, but the basic way to go get help is?
I can answer that sort of. It's different for each, it depends on your catchment area, like where you live at. And so there's 4, that Region 5, which is where I work, Region 5, which serves Pierce and Kitsap. So we have Good Sam, we have Greater Lakes, Comprehensive, and we have Kitsap Mental Health, I believe is what that is called. And then you can, as a foster parent, you can call and you can make a referral and say, I have someone who I would like to have an assessment done to see if they qualify for your services. And you would just need to, if they don't qualify, that's when you come back to your social worker and say, they didn't qualify, I really need some help here. Do you have other resources?
I've also heard that if you're going to make a referral to local community mental health, it's best to inform the social worker so that they know, and you're all in the loop.
Yes, and they can advocate for you as well. And Kitsap Mental Health, actually, I don't know if anyone's here from that area, the social worker has to go to Kitsap in order for the service to begin. Actually has to meet there for the intake appointment. So.
Isn't the tribe also has Tribal Mental Health Authority also is part of the RSN and Asian counseling?
The question was about the tribes, whether they have their own.
But they're part of the RSN.
You know, I don't know specifically. If you know that answer, then I'll let you answer that. But I don't know about that.
I just believe that the tribes also receive some RSN funding to serve Medicaid as well as Asian counseling services. And there's one other one, and it seems to in Pierce County.
Yeah.
Oh, Marriage and Family is at PLU, yes.
I would like you to help me extend a huge round of applause for our wonderful panel.